Hi everyone, welcome back to the Hair Loss Show. Russell, good to see you again.
Thank you, Vikram.
All right, so today we want to talk about a topic that we've talked about on the show before, but I think we'll sort of take a different spin on it, which is Dutasteride, right? You and I are big proponents in terms of medical treatment of androgenic alopecia, or both for men and women, but we've talked about Dutasteride, one of the 5-alpha reductase inhibitors. It's an off-label use, correct, for hair loss.
What that means in English is that the original research did not apply it to hair loss. It was applied to prostate enlargement.
That's right. But we found that it works in a similar way.
There's a serendipity there.
Yes, absolutely. And it's very effective. It's great, and it forms a big part of our practice in terms of
it's stronger than Finasteride. So when we have another one of the 5-alpha reductase blockers, so if your patient is starting to lose ground on Finasteride, let's remember how this works for all of these medicines. It's not that they stop working, but they have an effect that isn't a 100% effect.
Yes.
Right. So you have a really nice result for a couple of years, and then things just start to drift a little bit. And so what we've done in the past is this is when using a stronger medicine like Dutasteride comes in to supplement using the weaker medicines like Finasteride. And then where we have our aggressive balding young patients, we might jump straight to this because we figure that we're going to need that because otherwise we're not going to get the result we want. But the issue with Dutasteride, like the issue with Finasteride, is that people are worried about side effects. And yes, there is a higher incidence of the side effects, similar side effects with Dutasteride than there is with Finasteride, which figures considering...
Correct, it makes sense.
It's a stronger version. And one of the paradoxes we find is that sometimes we find that our patients who react to Finasteride, because we've done this, we swap them to Dutasteride, and amazingly, they don't react to the Dutasteride. They don't have any side effects. So again, it comes back to this concept that every individual that we treat is unique, and we can't always predict how they're going to respond to anything, because the logic doesn't always follow the reality. So one of the problems is that because people are a bit nervous about taking, some people are a bit nervous about taking the oral Dutasteride, is that, well, okay, couldn't we use it topically?
Yes. And
the problem with it is that the size of the molecule in Dutasteride is too big to get through the skin. So now the brainwaves have got, the brainy doctors have got together and worked out how to get it through the skin.
So just to represent that pictorially, because basically if you look at the surface of the skin is actually not a straight, it's not a sealed surface. There are actually tiny little holes in the skin which things can penetrate through. That's why we can apply things topically. And so if you've got a small molecule, yes, it can get through that those tiny little pores. And Finasteride is one of those small molecules. But Dutasteride is actually a much bigger molecule, and it does not fit through there. So traditionally speaking, topical Dutasteride, if you make Dutasteride into a solution and you can apply it all the live long day onto your scalp, it won't absorb
enough into it to have any clinical effect whatsoever. And that's been the problem about getting around the problem with the Dutasteride. But as I said, some new technologies have been developed.
Yes. So let's talk about, before we get on to the new ones, let's talk about pre-existing ways to try and get that through.
So the first thing that happened was that if you couldn't do it orally, the first thing they thought, well, why don't we inject it into the scalp?
Yes.
And that's called Dutasteride Mesotherapy. Something's pretty popular in South America and in Europe, for example, and starting to become a bit more popular in Australia. So you draw it up into a needle and then you inject it about half a millimetre under the skin.
Yes.
So it works. And I want to remind our audience that the half-life of Dutasteride is 5 weeks in the skin, so it's going to last a long time before you have to inject.
So you don't need to be doing it every day?
No, you can probably get away with every 3 months.
Correct.
Because it lasts so long, you probably do it every 3 months. But of course, you're going to go into the clinic to do it. There's a cost associated with going into the clinic to do it.
But also...
It's like painful to inject it in, and so some people use local anaesthetic beforehand, but that's painful to put the local anaesthetic in beforehand, and it hurts. So again, it goes against the grain for me and for you to look for the most painful way to treat our patients. We want to have a less painful way to do it. So if injecting it is painful but effective, are there other things we can do? And it turns out that recent research has suggested we can. So there is an Italian company that creates a combined machine that pats, meaning that they use an electrical charge to force molecules through the scalp, which is called iontophoresis, if you're interested in the the accurate word for it. And so they now make up a solution with dutasteride that you can actually drive through the scalp with electrodes. Then there's another American company that does it with ultrasound.
Yes.
That you can actually push things through the scalp. So the beauty of that is that you're not injecting and it's not painful. The downside is it's an in-clinic treatment.
Yes.
And therefore there's a cost associated with it. But the reality is for people that either are reacting to the dutasteride orally or want not to put it into their system, there aren't techniques to do it now, but those techniques do require in-clinic treatments. It's not something you can do at home.
So, I mean, the device you're talking about, it's a device. So it's the same molecule, but you're just using a device to try and push the molecule into the system. And the benefit of what you're talking about is that the solution, the particular solution you're talking about, has a multitude of other goodies in it as well. Correct. So it's got sort of peptides and other growth factors that they can add that will also, at the same time, boost and help hair growth.
Correct. So these are customizable, if you like, solutions to do it. Obviously, some people will also tattoo or microneedle these things in, and the logic again of that is going to be a problem because you have to dial down the dose of the solution if you're going to increase the absorption potential through the skin barrier.
Yeah.
So, if you're going to say, oh, well, I'd like to get, dutasteride and I'd like to microneedle it in, it's going to have to be not at the strength that you get in the capsule. It's going to have to be at something like 1/10 of that.
Yes.
Otherwise, you're going to get way too much going into the system. And, people should understand that even if you put it in through the scalp, inevitably some leaks into the circulation.
Yes.
The theory is it's around about a 1% absorption compared to taking it orally, right? And that's what the measurements have shown so far. But 1% is still 1%, right? In other words, it's a tiny leak. It doesn't just stay on the scalp. Some of it will get into the system.
And so, look, I think this is great. I mean, another way to deliver a really important molecule into the system that is painless.
Yes.
Right? That has been shown to be effective. Can be used in both men and also in women as well, right? Especially post-menopausal women.
Yes.
So now we were able to deliver this compound in that and see the benefits of that. So I think there's a lot of promise and positives.
And there'll be a lot more scientific feedback coming down over the next few years because the preliminary results look very encouraging.
Yes. And you would have done the same. I've spoken to people who use this and they're saying it's a game changer for them with a lot of their patients, both men and women.
Yes, well, I mean, from my perspective, we've moved past this is personal opinion, we're moving past the PRP era.
Yes.
I think the PRP era is coming to an end and we have better options now for our patients in doing PRP.
And just to, underline that, why, one of the reasons, I'm not saying, but one of the reasons why that's the case is that one of the issues that I've had with PRP is the lack of standardization across the board.
First, it starts with the patient.
Yes.
People have different levels of platelets.
Correct, yes.
Right? So the concentration is going to be different from patient A to patient B to patient C to patient D. Then there's about 5 or 6 different machines in the market. Some people do a single spin, some people do a double spin, some people take 20 mils or 30 mils, some people take 150 mils of blood to get the concentration. And the reality is that what the evidence suggests is you need a 4 to 5 times increase in platelet numbers with the centrifuging to actually put enough growth factors into the scalp to make an effect. And most people who provide PRP in the world do not achieve that.
But most people don't measure it.
Well, and they don't achieve it anyway because they don't take that much blood.
Yeah. So they don't do it. So I think you're right. Whereas something like this, where you can put a quantifiable amount into the system and you know that, okay, I'm getting this, and therefore you can measure the outcome associated with that.
And the other beauties of these things is that, we're talking about dutasteride, but as you said, in the same solution that you're using, you can put the peptides in, and put the growth factors in now as we understand more about what these things do, which is really quite important.
So really quickly, I mean, lots of clinics will be offering this treatment, but just really quickly, how long does the treatment take?
If you're using the Italian one, which is called Trichopat, that's 10 minutes of padding and 10 minutes of red light laser. If you're using things like dermarolling in solutions for exosomes or things like that, it's 10 minutes.
Yes.
So it's a very quick treatment and virtually painless.
Well, the Trichopat doesn't hurt at all, does it?
Well,
just
it depends on how hard you push it. Yeah. Obviously, you need gentle hands.
Yes.
But largely speaking, it just doesn't hurt. It doesn't cause bleeding. and you can resume normal activity straight away.
So it is the definition of a lunchtime procedure.
Absolutely.
You come in, quickly do it, and you can go back to your normal routine.
Absolutely.
So again, it hopefully answers the question, well, how do we deliver, a compound that is large through the skin that traditionally we weren't able to just do it topically with a topical application. So I think again, with the passage of time, more devices and systems will come into play that will do this. But I think it's exciting times.
Yes, and one last point I'd like to make to our audience is that the beauty of topical is, yes, you can reduce the amount that comes into your system, and therefore the potential side effects or reactivity. The disadvantage is it only works in the area you actually apply it to.
Yes.
So, for example, when you give people oral medications, every hair in the head is getting the dose.
Yes.
Right. When you're doing it topically, it's only what you apply. Only the area you apply is getting the medication.
Yeah.
So that can be a good thing, or it can be a suboptimal thing, depending on how accurate you are at applying it to where the areas are.
That's right. Good. All right. Well, thank you very much for watching. Hope you've enjoyed that. Please remember to like and to subscribe to the channel. Thanks again for joining us, Russell. And we'll see you on the next episode.
Thanks, Vikram. Thanks, everybody.